Whose car is that?
Congratulations. You got yourself a baby boy. Get the baby up to Skaboo. 1 month pregnant.
Since when did the reception become the new maternity ward?
Guess you weren't invited to the meeting. Mr. Griffin.
Blood clot.
She must have a placental abruption. Let Peds know the baby might have suffered from lack of oxygen. Stay with us, Agnes.
Cannula, and let's go to Dr. Keller. A little more private.
She was crowning. I was worried about her injuries.
Job well done, I'd say. A mother saved, baby boy brought into the world. It warms the heart. Mr. Griffin, I would like to transfer Mr. Malik to Keller.
What?
It's a strategy I'm trying, just to strengthen our skill base, shake things up a bit, keep everyone on their toes.
Greg!
Press release check. Local TV and radio check.
Stapler check.
My old thesis for the Batista door.
Greg! Hanssen's going to walk through that door any minute.
Guess I don't have time for a shower shave.
Shut up.
Notes in the margin. Tiny snapshot of who I was way back then.
What's Hanssen gonna do? Sack me for sleeping on his sofa?
How about getting drunk the night before a pioneering operation?
Yeah, that and I smashed his car window last night.
Greg?
Guess he probably won't like that much either.
Greg?
I said I'll pay for the damage.
Behaviour befitting a hooligan.
Come on, it's not like I spray-painted my tag on the hospital walls.
Is there anyone who can replace Mr. Douglas on the Batista door?
Shah and Mr. Douglas are the only ones with the experience and training.
Training that'll count for nothing if he's too hungover to perform a suture.
I'm actually feeling quite perky.
And how am I supposed to verify that? Get you to walk a straight line before the operation, juggle a couple of balls? Board would be very impressed with that, wouldn't they?
They would. I'm an ace juggler.
I do understand that you've been suffering emotional repercussions from the Ellie Maynard case.
Emotional repercussions?
And I sympathise, but I will not allow anything to jeopardise the procedure with so much riding on it. Holby's reputation, for one thing, a potential cash injection. If you're not fit enough to operate at your best, say so now.
I said I'm fine.
Mr. Douglas was scheduled to open the procedure.
Miss Shah, you will administer your colleague with a breathalyzer test before he begins his shift. And you, Mr. Douglas, will be issued with a formal warning.
Suture complete. Am I an asset to the team or what?
Right, Miss Shah, if you would proceed with a longitudinal tuck.
Gotta envy the guy. Only living in the moment, never having to agonise about the past or the future.
Bit of a nightmare, if you ask me.
Let's talk more surgery, please.
Okay, try again.
You've almost got it. Let me give you a hand. There you go. As easy as stitching a cut lip.
There's a thin line between confidence and cockiness, Mr. Douglas.
I know. I trip over it all the time.
Well, if it's not beneath you, perhaps you could start conducting pre-op checks.
Wherever you think I'm most useful.
Pre-op ECG, pre-op X-ray, group and cross-match blood for theatre.
I know the drill.
Continue. One could be forgiven for thinking that your mind's not really on it.
Haven't had as much time to practice as I'd like.
Wouldn't be anything to do with taking up the slack from Mr. Douglas, would it?
He deserves a chance.
How so?
He's a brilliant surgeon, you saw that for yourself.
It's not his prowess with the scalpel I'm concerned about, it's his attitude. He's arrogant, self-centred. He's not a team player. You sure it's wise for you to be defending him so passionately?
Meaning?
Fraternising with drunken Irishmen's not a good career move.
What are you implying?
Merely that defending a lost cause is doing you more harm than good. I understand that you feel responsible in some way, but you can rest assured that you did right by the patient, by her father, and by the hospital. If Mr. Douglas wants to crash and burn over this, I strongly suggest you step out of the way.
Are you deliberately trying to jeopardise this operation?
It just seemed like the right thing.
In other words, I suspect you've made a serious error of judgment. Would you agree, Mr. Hope? Miss Shah? Given that errors of judgment are the last thing we need today, I believe that Miss Shah would be better suited to opening the procedure.
Agreed.
Thank you. You'll be given a second formal warning. What is the baseball parlance? 3 strikes and you're out.
Don't let your heart get heavy.
Mr. Douglas, why don't you lead?
One moment, Mr. Douglas, please. Would you kindly explain to the board the benefits of the door procedure over those of more conventional assist devices?
By restoring the left ventricle to its correct elliptical orientation, we'll be increasing the mean ejection fraction.
By how much?
I was about to say 12.5%, as well as decreasing the left ventricular end systolic volume index, allowing for complete coronary revascularization.
Disadvantages?
Only that it places synthetic tissues in the LV cavity. But that's easily overcome by replacing the dacron patch with a septal hinge taken from the endocardial scar, or by using the autologous patches from the pericardium. Any other questions?
Proceed.
Yes? Wait, we've got a problem.
What do you mean, no blood?
According to haematology,
I sent for a group in Crossmount.
Did you check the blood was in the fridge before starting? Notes, please.
We've never needed to do that before.
Did you remember to check the notes?
Of course.
And?
Everything was okay.
It wasn't. Mr. Hanssen.
Mr. Douglas, I'd like to read the notes out loud, please, just for the benefit of the board. Would you read the notes, Mr. Douglas, please? Will you read out the notes, Mr. Douglas?
Antibodies present, needs type-specific blood. Contact hematology.
Sit down, Mr. Douglas. It's unsafe to proceed. Extubate the patient. Let's get him back on the ward.
Pre-op checks were your responsibility.
they were our responsibility.
They were my responsibility.
You do realise, had you made that first incision, Mr. Firth could have died for no other reason than we had no transfusion?
I realise that.
And that you've delayed the procedure till the end of the week? You leave me no choice but to issue you with your 3rd formal warning. You understand the consequence of this will most likely be your suspension and possibly your dismissal.
It was my fault.
No.
Yes, Mr. Douglas was covering for me. He asked me to check the bloods and I forgot. Give me the warning, not him. I'm sorry.
You do know that this will leave a black mark on your otherwise untarnished record?